Newsnight has seen an exclusive report which found that some Muslim women face maternity health inequalities, including being induced too early and being denied pain relief during labour, which can result in poor health outcomes. The report, authored by Baroness Gohir and due to be published tomorrow in the House of Commons, reported that women of different faith and race can be treated differently by healthcare professionals. According to senior midwife Donna Ockenden, who looked into the Shrewsbury and Telford review, told this programme the report makes grim reading and is at least as bad as some of the accounts in Shrewsbury and Telford. And Dr. Rani Thacker, the President-elect of the Royal College of Gynecology, has told Newsnight that the results point to racial discrimination. Yasmin Arakan has this report.
I think that because I'm black and I'm Muslim, there were lots of assumptions made about me.
Why would they be so dismissive of me? You know, few other people are getting treated like this.
Although pregnancy in the UK is generally very safe, we know from NHS data that black and Asian women are more likely to die while giving birth than white women, and more likely to have stillborn babies. Now the author of a new report based on a survey of more than 1,000 Muslim women says faith may also be a factor behind maternal health inequalities.
The higher maternal mortality rates for black and Asian women have been known for some time, 20 years or so, and finally health professionals and service providers are finally looking at the reasons why and considering that discrimination may be a factor, but the discourse tends to focus on race only.
Shai is a British Muslim of Pakistani heritage. She has a newborn and says that this birthing experience at Peterborough Hospital was flawless. But during her first pregnancy in 2017 at Newham Hospital in London, it was the opposite. Her health began to decline. She says when she expressed concerns about her pregnancy, nobody listened, and she feels that her concerns were dismissed because of her faith and race.
I was 30 weeks pregnant, and that's when issues started to arise. I was told, there's nothing wrong, you're just pregnant, go home. I had doctors refuse to see me because they were too busy. Multiple blood tests, urine samples were lost. I knew something wasn't right, and for weeks on end, nobody listened.
After several visits to the hospital and at breaking point, this time she insisted on speaking to a senior healthcare professional.
We were sent for an emergency scan. The consultant then told me my baby had stopped growing and the placenta was keeping his organs alive, and that they needed to get the baby out as soon as possible. And when I probed further and asked, well, what does this mean? The consultant's response was, you could die, your baby could die.
Shai was diagnosed with preeclampsia. Her baby was born healthy, but she feels things could have been a lot worse due to her treatment. Shai's experiences echo that of many other women, but she feels there was an added layer due to her faith and race, which made some healthcare professionals more belittling and treated her as a nuisance.
There was one particular incident whereby I don't think the individual, the healthcare professional, knew that I spoke English and was making remarks. Oh, can you just tell her to go home? There's nothing wrong with her. Why is she here again? So what if we can't find the result? In hindsight, if they had those results, they would have found that I had preeclampsia and they would have been able to treat me earlier.
Women felt that they were not listened to and they were not believed about when they raised concerns about their pregnancy or pain, or that they were about to give birth, and they felt like they were being treated like children, like a silly Asian woman, and that then led to quite unsafe situations.
By the time I went to the hospital, I had already been labouring for the whole night.
Sailor's daughter was born in Bristol at St Michael's Hospital in 2020. It was her fourth child. Sailor says she wasn't given the pain relief she asked for when her labour progressed.
So I kept saying to them that I couldn't cope with the pain anymore. Give me an epidural because I can't cope with the pain. And then she just kept saying, but you're so strong, you don't need an epidural, you're so strong and you have so many babies already.
Sailor says that she passed out due to the excruciating pain, and that her memory of the birth is blurry. Did you feel you were being treated differently to other mothers?
Yes, I think that because I'm black and I'm Muslim, there were lots of assumptions made about me. Like, do you work at all? It's like, you probably don't work. We probably have so many children. We probably don't speak very good English.
Baroness Gohir says some of the women she spoke to for her report felt that these sort of assumptions affected their care.
So some of the stereotypes around Muslim women was if they dressed in a particular way, if they wore the headscarf or the face veil or wore the jilbab, which is the long dress. Sometimes women felt that they were treated as if they were not educated or they couldn't speak English. So that really upset women, but also it meant that they had distrust in medical professionals and not then willing to share concerns that they had, and that obviously would then increase their risks as well.
BBC Newsnight has spoken to a number of women who took part in this new report, many of whom said that their experiences were traumatic. This is not the first report to raise concerns about maternity services in the UK.
Catastrophic failures in maternity care at an NHS trust led to hundreds of babies dying or being injured, a review has found.
Senior midwife Donna Ockenden carried out a review into failing maternity services at Shrewsbury and Salford Hospital, which found that women's concerns had not been listened to. We showed Donna this new research on the experiences of Muslim women, ranging from induced labour to being denied pain relief, including some of the extra barriers they believe were due to their faith and race. What did you think when you first read the report?
They were not listened to. They were not given the information they needed in order to make informed choices about their care. They were often belittled and not shown compassion when they needed it. This does make really grim reading and does mean that it is at least as bad as some of the accounts we found within the Shrewsbury and Telford report.
The President-elect of the Royal College of Obstetricians and Gynecologists says these health inequalities need to be addressed.
The RCOG acknowledges this report and the issues raised within it, and the experiences from the testimonies that Muslim women have outlined in this. The reasons behind this whole issue are rather complex. There is racial discrimination, which most of these results do point out to. But in addition to that, there are other social determinants. There's also a need to improve cultural sensitivity, and we are working with the Royal College of Midwives to improve training in this area.
I just hope that next time they are more thoughtful about the needs of Muslim women. We have a great NHS system, we have a great country, but some of us sometimes experience things that are not great.
Yasmin Arakan reporting. Well, the Department of Health and Social Security told us it had set up a task force to improve access to effective maternity care for all women, regardless of their background, and had updated its equality guidance. In relation to the two women in our film, Bart's Trust, which Newham Hospital is part of, told us, "We are sorry that the care provided to Mrs. Ul-Haq in 2017 fell below our normal high standards. Since then, we've introduced improvements, such as the Who's Shoes event, to help staff understand patient experience that was recognised as outstanding by the Care Quality Commission." University Hospitals Bristol and Western NHS Foundation Trust said, "We have been in contact directly with Ms. Manana about her concerns, and on behalf of the Trust, I would like again to apologise to her and her family as her experiences of our service in 2020 fell below the high standards we strive for." Time to finish now with a look at some